So many military kids are doing really well, and we don't want to overstate how vulnerable this population is, but we do want to be sensitive to the fact that military children experience some unique stressors that civilian kids don't really experience. And those stressors surround the deployment cycle largely. So, in the pre deployment phase of the deployment cycle, kids are learning that their caregiver is going to be deployed, and they start to make sense of what that's going to look like and who's going to do things like take out the garbage and who's going to take me to soccer practice. They have to start to do some thinking about concrete things and what it's going to look like after the caregiver is gone. And then there's the deployment phase when the caregiver is actually away. And this can feel pretty isolating and scary for kids, especially if they are in a family that's part of the National Guard or a reservist family where they're not on an active base with lots of other kids going through the same thing. So we really want to be mindful of this and get kids connected to as much support as possible during the deployment phase. And then there's the reunification phase, which is often a wonderful time for families, but it can also be a sort of unusual time because sometimes the caregiver will come back slightly different than before he or she left. So they might have a traumatic brain injury, or they might have some symptoms related to trauma exposure, they might have some physical injuries that they've sustained. And that can make it sort of difficult to adjust for the initial first several days, weeks, months after their family member returns. So what we want to do to help these kids and families is to provide as much support as possible, particularly if kids tend to be out in an isolated community without a lot of other kids going through deployments as well. So we want to encourage their classmates and teachers to be really objective and sensitive when discussing the war.